ASMR. Oh hi, I'm sorry I didn't see you there. Do you have an appointment? What name is it? Hang on 1 second. Okay, your appointment is in 10 minutes time. I'll just check you in there if you want to take a seat, and the nurse will be with you in a second, okay? Oh hi, I'm one of the nurses. Just let me put some gloves on, just for health and safety, and I'll be with you in a tick, okay? Won't be a second. Is it cold out today? It was a bit nippy this morning. I wanted to put my washing out earlier, but it was so rainy this morning that I wasn't able to. It's a shame really, because it's just so windy, isn't it, at the minute? You're not allergic to anything, love, are you? You're not allergic to latex or anything? Plasters or anything like that? Great. I'll just have a little look at your notes in a second. It's been such a busy morning this morning. Not had a chance, not had time. Right, okay, let's have a little look at your notes here and see what we've got going. So just confirm your name for me. Fantastic, brilliant. Okay, so it looks like you last came to see us a couple of weeks ago. So today is for a cardiorespiratory checkup, yeah? Okay. Have you had any other symptoms since your last visit? Any other problems? Great. And last time the doctor put you on some different medication, a beta blocker, has that helped? Fantastic. What I need to ask you about that tablet is, have you had any side effects? Because sometimes beta blockers can cause side effects like, yes, this is a cat friendly clinic, by the way, you'll see a cat in the background. This is a cat friendly clinic. Beta blockers can sometimes cause side effects like chilblains, because they cause like the blood vessels in the legs to just constrict a little bit, so it can cause cold feet. Have you had any of those problems? Brilliant. Any other problems at all with it, or have you been alright? Fantastic, great. And you're not allergic to anything that you know of? And is there any chance you could be pregnant? Fabulous, brilliant. And since we last saw you, have you had any more problems, any breathlessness? Because you was complaining about breathlessness on here. Yeah, this is Biscuit. It's a cat friendly clinic. What we do is we allow animals in this clinic for people that have anxiety. So yeah, this is the anxiety cat, Biscuit. You'll see her if you. This is why you've chosen to come to this clinic. It's a new thing that we're doing at the minute. Right, so what I need you to do, love, if you don't mind, I need you to just take your top off. You can leave your undergarments on underneath, but I need to just be able to access your back and your chest, because I'm going to have a little listen to your heart and your breathing, alright? So I'll just give you 1 minute. If you can do that for me, that'd be fantastic. Yes, you can bring in your dog to the next appointment, but you must have him or her on a lead, because what we don't want is any scrapping. When did you last have your blood pressure checked? So it wasn't long ago, it was pretty recent. That's great. Okay, what I'm going to do first is just have a listen to your little ticker. So if what you could do for me is just stay there for me. Do you get, if you don't mind me asking, do you get palpitations often? Like the feeling of your heart missing a beat, or like feeling of water in the chest? You've got a little bit of an irregular heartbeat there, but it's regularly irregular, and it's nothing that I'm too concerned about. And what I'm hoping is that the beta blockers that the doctors put you on will help to sort of correct that problem. But let me just have another listen again. And on this side. When was the last time you noticed any like palpitations or feeling that your heart's missed a beat or anything like that? Okay, we need to keep an eye on that, because it might be that we have to put you a 48-hour blood pressure monitor on, and that will also put a device on that checks your heartbeat as well, so we can sort of check it over 48 hours and see. And also what we'll do is obviously we'll review you as we're going on, and it might be that the beta blockers correct the problem. If not, it might be that we need to refer you on to a cardiologist to get your mitral valves checked, your heart valves, and have what we call an echocardiogram, which is where you lay on your side, and it's similar to an ultrasound, but we just look at your heart, and it shows us what the little valves are doing in the heart. It tells us whether there's like a leaky valve. Sometimes the valves, they open and let blood through, and then they shut to prevent backflow. Sometimes you can get a little bit of a valve that opens and then it doesn't shut too fully to get a bit of blood coming back through. It just causes a palpitation, and it's called regurgitation, where it regurgitates back through the valve. Usually it's not that serious, and usually the treatment is things like beta blockers anyway, and you're already on them obviously, but it might just be just to rule out any problems. We might just get you referred on to a cardiologist. Anyway, let me check your breathing if that's alright. So just turn around for me. Take a deep breath in and out. And take a deep breath in and out. Okay. What I'm going to do now, nothing to worry about at all. I'm just going to tap on your chest, so stay where you are for me. Okay, have you had any recent breathlessness? And how about when you're walking, say for example you are walking from your car into the supermarket where you've parked, do you have to stop because you feel breathless? Get your breath back and then start again. Great, okay, so how about when you're walking up a flight of stairs, do you get breathless then? And do you get anxious, worried about stuff? Yeah. Does that make you breathless? Yeah. Okay. Right. It could be that you've got a little bit of a chest infection, because there's a tiny, teeny little bit of consolidation there, which what that means is what we're doing when we're listening to that, we're listening to see if the lung is filled with things like fluid and infection. And if the sound is duller, it means that there's something there that's filling it. Okay, so it could either be like masses or it could be fluids from infection. So we'll get a chest x-ray sorted for you. When was the last time you had a chest x-ray? get that sorted for you, and we'll just see what it might just be that you need a course of antibiotics. And of course, if you've got a little bit of an infection, that could be making you breathless as well, because sepsis can also make you feel quite unwell and quite sort of breathless. So we'll get a chest x-ray for you too. I'm going to check your blood pressure now, love. Is that all right? What I need you to do, you can stay where you are facing me, but put your arm out. I know you can tell this is a cat clinic because all my arms are full of cat scratches. Yeah, it's from a cat, so don't be worrying about that, okay? Just put your mind at rest there. I've got a very young cat and she scratches me playing. So I want you to put your arm out for me like this, darling. I'm going to check your blood pressure. So this gets a little bit on the tight side. So I don't want you worrying about anything, because it just get a little bit tight, but don't panic. Okay, so arm out for me. And let's have a little listen. See what's going on with the old blood pressure. It should actually reduce a little bit on those beta blockers. Gonna get a bit tight now, so I'm sorry about that. Nearly done. Fantastic, we can take that off for you now, okay? Blood pressure isn't too bad, which is a good thing. That's a good thing. But it might still be that we need to still just get you referred for one of these blood analysis, just to be on the safe side, just to make sure, and also get you reviewed with cardiovascular clinic as well. We like to look after people in this establishment, this clinic. We like to make sure that you're well. Right, now we've sorted that out, I think what I'd like to do now is just take some sats. So you can put your top back on now, no problem. And I'd like to just for you to put your finger out for me like that. I'm going to put a little device on called a pulse oximeter. And what that does is it checks your oxygen levels, okay, and it tells me what your heart rate's doing and all that sort of stuff. So just put your finger out like that for me. And it just takes 1 minute for the results to come back, and then we'll be done. So let's see what your sats are doing. So let's have a little look. It takes a second. There we are, we're in. So it looks like your heart rate, so what your heart is doing, is 90 beats a minute. It's a little bit high, but it could be that you've got a bit of anxiety. And your oxygen saturation is 98%, which is fantastic. That's what we want. We want an oxygen saturation between 95 and 100%. So that is ideal. I'm dead happy with that. What I'm going to do now, okay, is I'm just going to have a little look at your hands, and I'm checking for things like any problems with your liver. I'm going to have a little look at your nails and just see. There's a lot that we can see through nails, like finger clubbing and pitting of the nails. Finger clubbing can be an indication of like COPD, which is where you've got breathing problems. Pitting of the nails can be a symptom of things like psoriasis and other dermatological conditions. We can tell a lot through the nails. You can see little black spots in the end of the nails, in the fingernails and the toes, and that can be an indication of like heart infections, like endocarditis, for example. So we can see a lot from your general health through looking at your nails. So just put your fingers out like that for me. Let's have a little look at those. I'm just going to press on those fingers to check what your capillary refill's doing. Okay, the blood's come back there within 5 seconds, which is ideal. We want, when we press on the finger, we want the blood to come back within 5 seconds, and it has done, so that's great. And your fingers there there's no obvious problems with those. maybe a little tiny little bit of a fungal nail infection going on there. What's your occupation? Do you have your hands in water for a long time? Sometimes when you put your hands in water, it changes the microenvironment, and that can cause fungal infections in the nails, for example. And also trauma. So if you ever drop something or trap your nail, trauma can cause fungal infections, secondary fungal infections. Fungus is an invasive. It's a little bit of a fungal infection. The best thing you can do for that is buy some surgical spirit, okay, and just dab a cotton wool bud in this with surgical spirit and just dab it twice a day, and that'll help with the fungal infection. It's because surgical spirit is an astringent, so it takes the moisture away, and the fungus doesn't like it. The fungus loves the moisture. So try with a little bit of surgical spirit every day, twice a day. If you're having any adverse reactions, stop doing it. Okay, let's see what else we've got now. So I've just got this little book here. I'm just going to update myself, okay, on your symptoms. Just give me 1 minute and then I'll get back to you. Obviously, as you know, the cardiovascular system is a very complex system. So let me see so we're looking on this here. Carotid, cardiovascular system, 21 to 73. Here we are. Let's see. Here we are, this is what I'm looking for. Have you ever had any heart attacks in the past? Okay, do you suffer from asthma? Have you ever had a pneumothorax, a road traffic accident or anything? Pneumonia and bronchitis? Well, we're going to refer you for an x-ray to check for pneumonia. Pulmonary embolism, hyperventilation, which we've said you get breathless sometimes when you have panic attacks, don't you? So we've covered a lot of those. No history of chronic obstructive pulmonary disease, no history of bronchiectasis or anything like that, pulmonary fibrosis, anemia. So we'll do some bloods as well in a minute to check for anemia. That's a good one. We need to check for bloods. Okay, so what we need to do you get ankle or leg swelling? It says here. Do you keep your legs elevated? So if your legs are swelling, try and keep them elevated at night time, and when you're resting, keep them on try and keep your legs on a pouffe thing. A few pillows on the bed just to elevate your legs. That helps the blood to come back to the heart. Palpitations you've got, and we've said that we might refer you on to a cardiovascular specialist. So I think we're on the right track here. So the cardiovascular system is an extremely important system. Okay, what I want to do now is I want you to just put your arms out like that for me, so that they're like, got all the cat scratches, so that they're like that. Okay, what I'm looking for is something called flapping, which is where the hands do that. And I'm also checking for any redness around the palms of the hands, and that can indicate things like connective tissue problems. It can indicate liver problems. It's great. So I'm just going to do that to your eyes, and I'm going to check for jaundice and that sort of stuff. Okay, so stay still for me. So I'll do one eye at a time. Okay, and now the other eye. Okie dokie, brilliant. Okay, you've got a little bit of a sore there. How did you get that black eye? Is everything okay at home? Is that sore to touch? Any problems at home? Any domestic abuse or anything like that? Are you sure? Because you know that you can talk to me and you can talk to us here, and everything will be kept confidential. Do you want me to just have a little look at that for you before we take bloods? Just give it a little bit of a clean up. Yeah. And you're sure that everything's okay at home, like nobody's treating you badly or anything like that? It might sting a little bit this because it's got a bit of alcohol in it. Okay, I'm just going to wipe it over for you, yeah? You okay? Is that stinging? That's iodine on my gloves, I do apologise. I'm going to put just a little plaster over there, okay? Do you want it to take a little information leaflet back with you about domestic violence? If you go into the ladies' toilets, then on the back of the toilet door there's an information leaflet on there with a phone number on. So if you don't like to tell me anything, then there is something on there for you. So, and if you look online, there are domestic abuse helplines as well. Just in case, just want you to know that nobody should be suffering from domestic abuse. It is not acceptable. So you need to get help and try and get out of that situation, okay, before it escalates. That's if you are. Okay, just stay still for me. Nearly done. Perfect. Might sting a little bit, just keep an eye on that for any signs of infection, any redness, any pain, any swelling, anything that you're worried about. If it bruises more or it's not healing or you get pus, exudates, we call it yellow oozy pus, then come and see us because we need to have a look at it for you, okay? I'm going to take some bloods now, so you just stay put for me. I just need your vessel there, so keep your arm out for me. Okay, I'm just going to put this round your arm first. Stay still for me. Okay, just one more. Okay, just clip all that. Perfect. The last thing I want to do is just check your temperature, okay? So I just want you to open your mouth for me. And open your mouth again. Okay, so that's fine. A little bit elevated, no chance you could be pregnant or anything like that. You're feeling okay in yourself, you're not being sick, you're not being lightheaded or anything. Fantastic, brilliant. Right, let me get my computer, Dewberry, and we'll just input all that there. So if you ask reception, we'll make you another appointment because we need to get you a chest x-ray. And we'll see what those blood results come back at and see if you're a little bit anemic or whatever. We can get that sorted for you. It might just be that you need some iron supplements and everything. So if you want to go to reception now, she'll make you another appointment to see the doctor, and then we'll take it from there. Alright, any problems, if you want to see me again, just let the receptionist know and we can book in again another appointment with me. But other than that, nice to see you. Take care of yourself, okay? Bye. Bye. Yes, is everything okay? We can make you another appointment, yep, no problem. Let me just have a little look here. So the next available appointment for the doctor will be next Thursday at 2 p.m. Is that okay with you? Should we book that in for you? Okay. What name is it? And what's your address? Number? Okay. And the best available phone number to contact you on just in case there's any problems. Okay, that's all booked in for you. See you then. Bye.